compliance, safeguarding, and accountability in the disability sector. Let's discuss. So we've seen the news. So at the time of recording this, just for date reference, it's the 19th of May 2025. I do the date reference because if someone watches this in 6 months' time, things are likely to be different again. We've all seen the news. If you haven't seen the news, then you're probably not in the disability sector or in NDIS. So a couple of things have been going on. Providers are being banned. And when they're being banned, many of them actually just go and get a friend to get an ABN and they start up again. So whilst they're technically banned, someone else has actually started up on their behalf. So they're still working with people so they can still repeat the same patterns of behaviour. The consequences weren't enough to protect people with an NDIS plan. Every day, at least 5 to 6 times a day, I get a message or a phone call and it's like this: Jackie, I'm not getting paid. And then we find out the participant has run out of funding, so the provider's not going to get paid. Jackie, I've run out of funding. What do I do? I've still got 6 months to go. Will NDIS top it up? No, they won't. Unless you've had a change of circumstances. No, nothing has changed. I was just going along and I was listening to my support worker and they suggested this and they suggested that. And when I sit down with those people, whether it's the participant themselves or their informal support, and we actually look at their plan, they could never have a Sunday plan and 4 to 5 hours during the week as well, because they just weren't funded for that. Now, I'm not going to get into NDIS have underfunded me and my plan because that's a really hot topic. And at the moment, there are over 717,000 people on the scheme with a budget of $46 billion to cover them, which would average it out to be about $50,000 per person per 12 months if we were to give it evenly. But we know that there are people out there that need 24 hours support, so $50,000 is just not going to cut it. We've already seen that ratios for SIL have gone from 1 to 1, in many cases to 1 to 3, 1 provider to 3 participants. So we've already seen that. But my big thing is, how do we safeguard this scheme? Do we need something like what AHPRA does, which is nurses have to be registered with AHPRA, and if you don't renew your nursing registration, you can't work as a nurse. It's kind of that simple. And if you don't have active hours, so a certain number of active hours over 5-year period, so you can have some time off, that's okay. But say you know in 5 years, if you haven't done, 450 hours, for example, then you would then have to go through some form of refresher, and so that they knew that you were safe. Now, AHPRA will do investigations. They will put conditions on a nurse's registration, a doctor's registration, and then the whole public can check that and see it. So that then if a person breaches those conditions, that can be reported, but also an employer can actually check that. Family members can go ahead and check it. So it's actually quite easy to check it. Now, yes, the NDIS have their list of who they've banned or restricted or whatever, but unlike AHPRA, there's ways around it and people are doing it. There's shell companies that have been set up that we've heard about in the media that have, the minute one part of the company has been, or one company has been put into payment lock, they then just transfer everybody over to another company that they've got connections to, and then sometimes they've got another one, or the family member goes, don't worry, I know we're in payment lock, but don't worry, I'll start up a company in my name, it's all fine, we'll just transfer everybody over there. And it's like, it's getting really hard. when complaints are lodged for unregistered providers, it doesn't seem to make any difference, or it takes years, and by that time somebody could be seriously injured, somebody could die, all of this. I worked in complaints at a big Melbourne hospital. We did get compliments as well, but, and as I've shared in other videos, complaints were taken seriously. We would have X amount of time in which to respond. So we'd do the initial acknowledgement letter, and then we would do a response, and that response, we aim to knock that response out within 14 to 21 days. Now, we had to do investigation, and it meant I had to go and talk to people, and I had to read case notes or progress notes. Sometimes the legal team were involved. We had a way that we did it, that we got a response out to somebody. Now, sometimes they weren't happy and they took it to the Health Service Commissioner, and then that involved bigger meetings and more people and all of that. But we did it. We did it. Now, I know that sometimes when we lodge complaints, we don't always get an answer that we're satisfied with. I get it. I've been on that part where I've lodged a complaint and I've gone, well, that was a waste of time, wasn't it? But behind the scenes, there's certain things inwardly that the organisation or the business have had to do and had to look at. So just because the answer that I got doesn't necessarily mean that was the end of it. The organisation, I know that in times we had to show evidence that we had made quality improvements to the commissioner, to the Health Service Commissioner. We had a certain time frame, and we had to show them that we had actually made quality improvements. Now, the biggest thing in NDIS is the divide between the unregistered providers and the registered providers. And if there's only about 14,000 registered providers and there's over 200,000 unregistered providers, then are they only governing 14,000 businesses properly? Now, I understand there's the NDIS Code of Conduct, but my question is, are they only governing the registered providers? Like, what's going on over here with the other 200,000? And how can this be rectified? Do we need an APRA type registration for anybody that's stepping in to be a support worker or a support coordinator or a plan manager? Do people need to be submitting, signing statutory declarations as part of that they have not committed a criminal offence, that they haven't done A, B, C, and D? And then that stays on that database. And so if a complaint is made that somebody has done something, that can then be looked into that database the same as it does with APRA. Now, I'm using APRA because I'm familiar with APRA, but there's ESSA. Even in the personal training industry, there's ways and means. There's also Australian consumer law as well. In that, and the other question I want to ask is, who's actually checking that it's actually the participant that is endorsing the registered providers? Because I've heard on more than 5 occasions this year alone of where participants are now, funding is being removed from their plans by registered providers. And I'm not backing out registered providers. Unregistered providers do something similar, but they just do it in a different way. But somebody has rang up and said that they are the participant and they endorse this particular provider, but the provider doesn't show up to do any services because they're actually not. They're not anything to do with that participant. And the money gets drained out of their plan because somebody rang up and said, I'm Mary Smith and this is my NDIS number and da-da-da-da-da. They've got their details from somewhere. And this is draining participants' plans, which is leaving them without support. Is the NDIS meant to be broken so that they can go, well, it didn't work? Because guess what? It actually does work. There's a lot of there's a lot of glitches in the system. I have heard from so many people this weekend about the launch, the change that's come in today about the funding periods, so that, for example, a 12-month plan might be divided and the funding's released every 3 months, and everybody's going, no, this shouldn't happen. I'm never going to get paid, and what happens with this and what happens with that, and they're kind of yelling at me, and then they're sending me private messages. Just a hint, I'm not the NDIS and I'm not the NDIA. I'm just sharing information so you know what's going on, and by the time it hits your people, it could be 6 or 12 months down the track. But what I'm hearing is, Jackie, we need to rally against this. We need to start a protest. We need to not do this. Okay, I'm not going to organise a rally or a protest. There's a lot of things that are in the NDIS legislation that came out on the 3rd of October that is starting to weave in. We're also now under a health model versus a social model, the social services model. So being with health and aged care, does that mean that there could be some easy connection and collaboration between the two? Does that mean that it becomes, with the needs assessments coming out soon, that it becomes more of a medical model than a social model? Like, there's lots of questions. Mandatory registration, still on the table, but we still don't know much more about it. I'm just raising a few questions. I'm just wondering, like, where is all this going and what your thoughts are in a proactive, positive way. Telling me that it's not going to work, yeah, I kind of see that it could work, but I can also see the glitches, so that's kind of not going to solve anything. But if you've got some thoughts and ideas on how we could collaborate properly and actually shine a light on the providers that are doing the right thing, the amazing thing, and that are there for participants, then let's talk about that. Let's go, when there is a problem, the one thing I've learned when there is a problem, if you go to the relevant party with just the problem, hey, your system sucks, they're going to go, that's nice, thanks for letting me know. They're not going to listen. If you go with some possible solutions, hey, I'm really concerned about this. I'm wondering who's safeguarding everything, who's actually protecting the money. Like, if we had better quality and safeguards in place with serious consequences, fast actionable consequences. I know investigations need to happen. I get that. But some form of actionable thing so it can be stopped. Maybe we wouldn't need to spend as much money on fraud investigation that we are currently doing. At the end of the day, though, the government only has X amount of money. The bank account only has X amount of money for the whole of Australia and everything that we have. And hospitals are stretched to the max. Ambulance officers are stretched to the max. Victorian farmers are absolutely stressed to the hilt now with the new land taxes, right? There's other businesses in Victoria that are really concerned about the land taxes that have just dropped for Victoria. So maybe the bigger picture is, let's look at how we're actually spending our money as a country. And instead of our I want more, let's maybe look at how can we make this work with what we have that works the best for the majority. We're never going to please everybody, I know that. I'm just throwing out a few ideas, and the NDIS is a big concern because people are getting seriously injured, they're getting taken advantage of, and this seems to be getting worse, at least by the sheer number of phone calls and messages I get. I'm taking a break very soon. I'll be doing some different posts, but I am going to be not on social media and that as much. Come June, July, I will post little bits. I'll do motivational videos when I can. But for the whole of it, I actually need a break because the negativity, the toxicity is actually getting worse. And I have some amazing solutions that could be looked at and discussed that could potentially save money, but it's how do we present it? When is a good time to present it, and who does it get presented to? Wherever you're seeing this video, like and follow, subscribe for more, because I will be doing more, but not just on the NDIS. My business is empowerment for businesses and empowerment for personal transformation as well. I am still bringing out my new book very soon, so you might want to like, follow and subscribe just to hear about that as well. So stay tuned. They'll be on our Spotify podcast. There'll be some members only content coming out really soon as well. But please, let's support each other. Let's do the best we can, that rather than attack and say this isn't going to work and it's horrible. I get it, it's frustrating, but let's see what solutions we can come up with as well. I'm not saying they're going to be taken on board. It's just a suggestion. Let's see what we can do.